And the purpose of World AIDS Day is, of course, to raise awareness about HIV prevention and treatment in our state, but also to remind people that this is a disease that we have not quite conquered yet. And also an important opportunity to demonstrate that people who are diagnosed with HIV and AIDS can lead productive lives and meaningful lives. But to also be reminded on occasions like this that this continues to be a very serious public health crisis. There are 35 million people, including more than 3 million children, who are living with HIV and AIDS today. Most don't even know that they've been infected. Here in our own country, there are more than 1 million people living with HIV and AIDS, including 3,000 Rhode Islanders. And since HIV was first identified in the 1980s, we've made really significant and remarkable progress in identifying, treating, and preventing the transmission of this disease. New HIV infections worldwide have fallen 33% since 2001, and AIDS-related deaths, which peaked in 2005, are down 30%. So this is really significant progress. But despite all of this progress, there is a tremendous amount of work still to be done. 1.5 million people died from this disease in 2013, and about 50,000 Americans are diagnosed with HIV each year. This absolutely should not be happening in 2015, and so we shouldn't be satisfied with the progress we've made. We really do have it at our disposal to achieve an AIDS-free generation in our time. And it's not really a question of whether we can do it, it's whether or not we have the will to do it. And for my part, I've advocated funding to the House Appropriations Committee for Ryan White funding, which is really important, and works with cities, states, and communities, community-based organizations to provide HIV and AIDS healthcare services for more than 500,000 Americans who don't have the financial resources or health coverage of their own to get the care. I led a letter each year for the last 3 years with a Republican colleague, Ileana Ross-Layton of Florida, requesting that the House Appropriations Committee provide full funding to research and develop a vaccine to prevent HIV infection. And so, while we have, I think, a lot to be proud of in terms of the progress we've made in Rhode Island in particular, because of the work of so many people in this room, this is a reminder that we should be looking forward to the day when we don't have to have a World AIDS Day, that it's a faint memory that we've conquered this disease, we've stopped the transmission of infection, and we've found a cure for HIV and AIDS. And all of the work that you are doing, both as individuals and organizations, will bring us to this day. But World AIDS Day is an opportunity to honor those we've lost, to remember the challenges ahead, to be sure we're educating people about this disease, and to build public support so that we can devote the resources that are necessary to once and for all eradicate HIV and AIDS. So thank you to the governor for hosting us. I know she's running late. That's why I had to go first. But thank you to the governor for hosting our event today to recognize World AIDS Day. Thank you.